Hello, and welcome to a new episode of the Network Voices interview series. In this series, we pair members of the Marathon of Hope Cancer Centers Network's patient working group with network researchers and clinicians. Before I introduce today's guest, I think we should introduce ourselves. What do you think, Sarah?
Sounds good to me.
Excellent. Well, my name is Kirsten, and I am based in Toronto, Ontario. I hold a Bachelor's of Science and a Master's of Public Health. I enjoy staying active through hiking, tap dancing, and chasing after my beloved fur friend, Winston. As a pediatric and young adult cancer survivor, I use my story to inspire and advocate for others, and I'm an active member of the patient working group, contributing my insights to improve the lives of fellow patients. Sarah, on to you.
Thanks, Kirsten. I'm Sarah, a young adult cancer survivor with myxoid liposarcoma from Cambridge, Ontario. I'm a speech language pathologist and a patient advocate. I enjoy hiking, painting, reading, and training my service dog, Molly. I'm a proud member of the patient working group and hope to keep working towards having all cancers equally included and represented in the research landscape going forward, including rare cancers.
Thanks, Sarah. It is my pleasure to introduce today's guest, Véronique LeBlanc. She is a network program manager and scientific writer at the Terry Fox Research Institute. She completed her PhD in cancer genomics with Dr. Marco Mara at the University of British Columbia and Canada's Michael Smith Genome Science Center in 2021. And she joined TFRI in 2023. Leveraging her research experience and her passion for science communication, Veronique works closely with the team at TFRI to advance network activities and highlight developments and success stories. Today, we are going to be talking to Veronique about an exciting milestone that the network just reached with the publication of an important scientific paper, referred to as a marker paper. This paper serves as an introduction of the network to the global scientific community. Veronique helped write the paper and navigate it through publication. So we're keen to ask her about the process and what that paper means for the network and its members. Thanks for joining us today, Veronique.
Thanks so much for having me.
First off, can you give us an overview of the paper and the people who contributed to it?
Yeah, absolutely. So, like you said in your intro, the paper gives an overview of the network, a little bit of its history, how it came together, its goals, and some of its accomplishments to date. And I really like the part of your question about who contributed to it, because I think the really wonderful thing about this paper is that it really shows the truly impressive scale of what is the Marathon of Hope Cancer Centers Network. So there are more than 1,200 people listed as collaborators on the paper, including both of you and all the members of the patient working group, of course. There are also more than 100 funding partners and dozens of other partners who have contributed, such as biobanks across the country. And so we think this is a great opportunity both to introduce the network to the global cancer research community and to recognize the contributions of everyone who has done work on this and helped make the network possible so far.
Wow, that's a lot. Can you tell me a bit more about how this paper all came together?
Yeah, I would love to. It was quite the process, but I learned so much. So a little bit of history. The paper is something that the network has been discussing for a while. And actually, one of the reasons I was brought onto the team was to help move it forward. And so in terms of timing, we wanted to wait a little bit until the network was established and we could share some of the successes, the learnings, and a bit of future vision and ongoing work. And so we thought that this was a really great time. A few years into the network, there's so much that's happened already. It was a great time to really showcase that to the research community. And so in terms of how this all came together, one of the first things that I did was to meet with the chairs of all the working groups. We have 15 working groups and subgroups so far. And so I met with the chairs of all of those to learn more about the work that they had done to date, the group's mandate, and where they see the group going. And so this was early on after I joined TFRI, and this was a really great crash course for me to learn all about what was going on in the network. And then that was a ton of information. I worked closely with Dr. Marco Mara. He's one of the leads of the BC Cancer Consortium, and he's at UBC. He was also my PhD supervisor, as well as Dr. Ian Watson from McGill. And I worked closely with them. They gave me a lot of support to put together a solid first draft. And I'll be honest, the first draft was way too long. I had gathered so much information and wanted to fit it all in. But I got a lot of help from Dr. Mara and Dr. Watson to condense it and really make it into something a little bit more manageable. And so once we had that, we circulated it to the network steering committee. We got some really great feedback from them. I reworked the draft a little bit to address the feedback that we got and the suggestions that they made. And then we circulated it to the network council. And that would the feedback that we got there were shorter points. And generally they seemed really positive about it. So that was fantastic. And I'm condensing many months of work into this here, but we were finally ready to decide where we wanted to publish. And so we wanted to aim high in terms of where to go, because we think that this initiative is really important. And we thought that it would be of really good interest to the research community. And so we reached out to a journal called Cancer Cell. It's a prestigious journal in the family of Cell Press that's really well regarded and well read in the cancer research community. So we decided to reach out to them. We were thrilled to hear back from the editor-in-chief that they thought this was a great initiative and they were really excited to publish it. So they asked us to shorten it into a type of article called a commentary. So once again, we had to cut some words. We cut it in about half. And again, condensing a lot of things, but we were finally ready to submit it. And now here we are getting ready for the paper to be published on April 3rd. If I can add one more quick thing about the process, one thing that I definitely underestimated was how much work would go into putting in that author list. So I mentioned earlier that we have over 1,200 people. I worked closely with a lot of the project managers that contribute to the network, and I really want to give them a shout out because I wouldn't have been able to do it without them. But we reached out to all of these people, confirmed, added a bunch of people to the list as we went. But it was really a great exercise to actually put all those names together of everyone who's contributed to the network so far.
Thank you for explaining all that. That's a lot that goes into that paper, that's for sure. Why do you think it's important to publish a paper like this, and what audience is the network trying to reach with it?
Yeah, thanks. So the main thing, and I think I've touched on this a little bit already, but the main thing is that we want to share the network with the research community, especially. So we, of course, want to share the network with everyone, the public, everything else. But this paper in particular is a great opportunity for us to reach out to the scientific community. And as I said, I think there's going to be, or we think that there's going to be great interest from the scientific community because of what we're doing and the scale of what we're doing. And we also expect that it'll prompt new collaborations and interest in the data set that we're developing, both in Canada and all across the world. So I think I touched on this a little bit earlier, but it really is an opportunity, and this is why we waited a little bit until the network was established. It's an opportunity to share learnings so far. So this could help if other groups around the world are trying to set up similar initiatives, or even other groups in Canada trying to set up similar initiatives in other disease types, for example. So I touched on this a little bit, but the network has 15 working groups and committees and subgroups so far. And these are all made up of experts from across the country who are putting together really important policies and guidelines that are that are guiding the work of the network, but they're also made freely available on the network's website. And I don't think that a lot of people outside of the network know that. So these are really valuable documents that we think that other people in the research community can benefit from. And one thing I'll add is that the network is taking a fairly unique approach in that it's taking a federated approach to this kind of work. So other large-scale genomics and cancer genomics initiatives that either historically or even now, they're often quite centralized. So one example is that maybe all the sequencing is done in maybe one or maybe a few centers, but using the same procedures and methods and technology. On the other hand, what we're doing is kind of taking a different approach. The network is setting standards and guidelines through its working groups, like we were just talking about. And individual contributors or member sites can decide the best way for them to reach those standards. So they don't necessarily have to use the same technology. They don't necessarily have to use the same exact procedures or protocols, but they can use what works best for their unique capacities and strengths and abilities. And so we think that this kind of decentralized, really large collaborative effort is the future of research, large-scale research, and things like data sharing. So we think that this is an important example to share with the community, and we think there's a lot of learning that can be done.
That sounds absolutely intense and definitely a labor of love. You spoke a little bit about collaboration. And in the paper, it talks about needing to break down silos to enhance collaborative cancer research in Canada. Can you tell us about why this is important and how the network has helped increase collaborative efforts across Canada so far?
Absolutely. Thank you, Kirsten. This is a great question. And I think it really gets to the raison d'etre of the network. So we, maybe I can provide a little bit of context like we do in the paper, because it's, again, meant for a global audience. We gave a little bit of context about the Canadian cancer research ecosystem. So maybe I can start with a very short recap of that. We know that here in Canada, we have world-class researchers who are really, truly at the forefront of cancer research innovation around the world. We also know that a lot of efforts, not all, but often, some of these efforts are siloed. So individual groups, individual institutions, individual provinces might be doing things a little bit in their own sort of ecosystem. And part of this is because, as you both know, Canada is a confederation of provinces who are responsible for healthcare and who each have their own laws and regulations. And so this can make things like data sharing a little bit challenging sometimes between jurisdictions. And so fundamentally, the network was created to address these challenges and to unite the talented researchers and clinicians and administrators and other partners that we have all around the country, together with patients and caregivers and survivors and other people with lived experience, to really create a coordinated national strategy to advance precision medicine. And so we think that this kind of coordinated approach really helps leverage the strengths that we know exist in this country. And at the end of the day, it makes the whole more than just the sum of its parts, right? If I can maybe share just a few examples, I think part of your question was how the network has done this so far, has promoted this kind of collaboration. So maybe I can share a few examples. We've talked about the working groups already. I think those are a really great example. They're bringing, like I said, experts from all across the country working together. They're sharing knowledge, they're sharing resources to create these guidelines and these policies that, as I said, we're posting that are made freely available on the website. I think another really good example of, especially on the research side, or kind of on the applied research side, is when it comes to rare cancers. So, Sarah, I know you mentioned early on, making sure that everyone, even people with rare cancers, are able to participate in research and getting the best possible care. And so, as I think you both very well know, rare cancers can be challenging to study, partly because a lot of research depends on samples donated by patients. And by their very nature, rare cancers, there aren't a lot of those samples, right? So if you're working within your own institution or even within your own province, you might not have access to all that many samples, which makes research more difficult. And so in 2022, the network launched a competition called the Pan-Canadian Projects. And these were really meant to fund multi-center collaborations. And 20 projects were funded, but several of these focused specifically on rare cancers. And they're leveraging the fact that these teams are made with people from across the country who can share samples, share data, share resources, share knowledge. And so that's just one example, but a lot of these follow kind of the same model. And then really the important thing at the end of the day is sharing this knowledge and these data. And we're seeing that, back to your question about how we're making this happen, we're starting to see some data sharing happening within the network. All of the processes and everything are still being worked out, but some groups are already doing this, including through the Pan-Canadian projects. And I think, one thing, the examples that I've given about the rare cancers and the working groups, they're all quite technical, but another really important reason for why this type of collaboration is important is that, we know, that Canada is a huge country with a very unevenly distributed population. And we know through research that we know that patients who live in or maybe near large urban centers, they have more opportunities to receive state-of-the-art care, to participate in clinical trials, to participate in other kinds of research, compared to patients who live in more rural and remote areas of the country, or even in smaller cities in our provinces. And so by bringing cancer centers and researchers across the country together under a unified vision, the network's goal is to really make quality precision cancer medicine accessible to everyone, regardless of where they live. And I'm thinking of a saying that Dr. Sherry Christian, she's one of the leads of the Atlantic Cancer Consortium, she shared a saying in a recent researcher profile that we did with her of a high tide floats all boats. And that's really what collaboration does, we think. And this is why the network exists, really. Collaboration helps everyone. It helps smaller centers who might not have the same resources and capacities as larger centers. It also helps larger centers do better research that is actually representative of not just people who live in cities. So I think there are a lot of reasons why collaboration is important, and a lot of ways that the network has started doing that, and I'm excited to see where we go from here.
Thank you so much for explaining all of that and bringing the importance of collaboration. One of the groups that you keep bringing up, and that's important to both Kirsten and I, is the patient working group. So I just wanted to ask a question about that. So the paper talks about the patient working group and how it purposefully includes people with a diverse set of perspectives. For example, includes members who were diagnosed with cancer as children, adolescents, young adults, and later in life. It also includes people with rare cancers such as myself. Knowing that Terry Fox was a young adult when he was diagnosed with cancer, how do you think that having these different perspectives represented in the patient working group affects the work that the group does and how it has a role in the network?
Yeah, thank you for asking that question, Sarah. It's a really important one. I don't have to tell both of you this, but the patient working group has really been a driving force to make sure that network activities actually address patient needs and patient priorities. We know that too often cancer research is disconnected from the people that ultimately it aims to serve, the people who experience and live with cancer. And thankfully, I think that this is changing. But especially within the network, the patient working group is absolutely key to helping us achieve those goals, and for really the network to become a leader in patient-oriented and patient-centered research. So why is it important that we have a diverse group to do that? Again, I really don't have to tell you this, but cancer is a deeply personal experience. No two people are going to have the same experience. And the example of Terry, I think, is of course a fantastic one. Someone who's diagnosed as an adolescent or a young adult or a child is going to have a very different experience than someone who's diagnosed later in life. And this is why we think that having these kinds of diverse voices and perspectives represented on the patient working group is so important, because the needs and the priorities of people with different experiences will be different. Now, if we could ask every single person in Canada who's dealt with cancer, whether it's, a patient or a survivor, caregiver, that would be great, but we can't. So we have to choose, or we have to find a group of people who can help us represent those perspectives. We think that the patient working group is a wonderful, diverse group of people with different perspectives and experiences who can help us and help the network really get an idea of what those different needs and priorities might be. And maybe one other thing to add there is that it's also great. We've been asking a lot of the patient working group members, as you both know. You have all been doing so much for the network. And I think having people, you all bring, your experiences, your expertise outside of cancer, and you all have very different life experiences. And it's great that we have people who are interested in different kinds of opportunities within the patient working group. So maybe to be able to give a few examples, some members have been very active in the media and have been wonderful spokespeople for the network. Some people might not want to do that, and that's perfectly fine. A lot of members took a lot of time out of their lives this past summer and fall to review grant applications from the Patient Voices in Research Initiative. And they ultimately helped select 10 successful applicants who were funded through this program. These are just kind of a couple of examples, but it's nice to be able to offer opportunities that might align better with interests and values and the amount of time that people are able to dedicate. So I think there are a lot of reasons why we need to have diverse voices represented on the patient working group and why it's so important. But that's my perspective from, someone who works with TFRI. Can I ask you why you think it's important?
I think as a patient, especially someone from the rare disease and the young adult perspective, for me, it was really important that I was included. I find in a lot of places, the rare disease and the young adult perspective is often overlooked or missed out on. And so the fact that it was included and thought of as an important perspective was a really valuable thing to me. And when we come to a table as a group, as a working group, everyone's perspective is thought of as equally as important, and that's a really valuable thing to me. We're all thought of as equals, and all of our opinions matter. We're all learning from each other, which is great. I love that all of our experiences help each other learn. If someone's having a hard time, we're there to support each other as well, which is a great experience.
Do you want to add anything?
Yeah, just for me being probably one of the few pediatric representatives. I was diagnosed with cancer at 10. I often tell people that cancer doesn't discriminate. It doesn't care what age you are, what, anything about you, it'll hit you. So I think it's important to have all those perspectives, especially the pediatric perspective, which is also a rare cancer as well. And many pediatric survivors don't remember their experience because they're often diagnosed so young. Unfortunately, but fortunately, I'm lucky enough to remember my experience. I don't know which one that is. So I like to share that story and, kind of bring that perspective in as well. Um, and absolutely love that the patient working group and patients in general are absolutely dispersed across the organization. We are in working groups, we are in grant reviews, we have our own group. And like Sarah said, all our ideas, thoughts, and opinions are just so well respected and received from TFRI that I think it makes it a very unique patient working group.
Thank you for sharing that.
Yes, so now we're gonna focus back on you, Veronique. And I think you touched a little bit about this in your previous answer around collaboration, but how is the network ensuring that its data set reflects the diversity of people within Canada and across Canada with cancer, including people of non-European descent and people from rural and remote communities?
Yeah, thank you for that. It's another really important question. If I may give a little bit of background to that again, for anyone who might not be aware, I think you both are. I just want to underscore the fact that a lot of genomics research suffers from a lack of diversity. And in particular, people who are not of European descent are usually often severely underrepresented in genomics data sets, including cancer genomics. This means that research done using these data sets is not always generalizable to broader populations. It might only apply to the people who are actually represented. And so this leads to unequal outcomes, together with other factors of structural and systemic racism that we don't necessarily need to get into, but these exist. These are part of the reason why these discrepancies exist in research, and these are part of why equal or outcomes are not equal across everyone with cancer. If I can share a couple of examples, we know in Canada that Indigenous peoples have an increasing incidence of cancer and experience poorer cancer-related outcomes compared to non-Indigenous Canadians. We also know, as another example, that Black individuals have worse outcomes in at least several cancer types compared to white individuals. And so I think, as I mentioned earlier, the goal of the network is to accelerate precision medicine, to make experiences and outcomes better for all people experiencing cancer across Canada and hopefully beyond Canada as well. But to create solutions that have at least the potential to benefit everyone, it is crucial that the research and the data are actually represent those people. And so here we're talking about the gold cohort, the large data set that the network is currently putting together. So that data set needs to reflect the diverse populations that make up Canada. So this means that it needs to include people with different genetic ancestry. It needs to include people who live in urban, rural, remote areas. It needs to include people with different cancer types, including rare cancers, people across the age spectrum. All of these people need to be represented. And so we know why that's important. how is the network doing it? So this work is really led by the Canadian Spectrum Working Group, so one of our working groups that we've been talking about a few times in this conversation. And they are really leading efforts to make sure that this data set is representative. A few of the ways that they're doing that, they are supporting ongoing work to identify existing gaps, so we can't address what we don't know is a problem. We know some of the gaps, some of the other ones still need to be researched. They're also creating strategies to engage with underserved and underrepresented groups and communities all across the country. I wrote down a quote from one of the group's co-chairs, Dr. Nadine Caron. In a recent or I guess it was back in 2023, she published a Network Voices piece in the Globe and Mail. And she pointed out that, and I quote, 45 years ago, when Terry said he wanted all Canadians to be a part of his Marathon of Hope, he really meant all Canadians. New Canadians, rural Canadians, urban Canadians, Indigenous peoples, and other minority and racialized groups, unquote. And so, yeah, we need to make this happen. We have a phenomenal group of people in the Canadian Spectrum Working Group who are helping us, make this happen. It's a multi-pronged approach, and we're always learning more. But we hope that, through this learning, we can make this a reality.
Sarah, just before your next question, I just want to say that I love a theme around all these questions, just learning more from everybody. I think it's great. We're learning more from what we don't know or what we might not know we don't know. We're learning more from patients, from physicians, from everybody.
That's a great point. Thank you, Kirsten.
Yes, thank you. So to wrap things up, what was the most surprising thing that you learned about the network and the research it's supporting while working on this paper?
Oh, that's an interesting one. I think I continuously surprised myself with just how much more, well, to Kirsten's point, just how much more I could learn about the network and the people who are part of the network. I feel like several times, I was thinking, okay, I got this. I've got a good grasp on what the network is. And some new information always came up. And new people reading the paper had new ideas or suggestions or points to clarify. It's such a huge initiative. And we have so many more people working on so many different aspects of this network that, I won't say that I've learned everything about it. I think I've learned a good deal, but there's always more. So I think that was great. Especially I think I mentioned this earlier, but it was especially a great way to get started with GFRI. It really did force me to learn what's going on within the network, and it was a really effective way of doing that. I don't know that surprise is the right word for this, but I was pleasantly surprised and appreciative of the responses that I got. So I was talking earlier about putting the author list together, and we made sure that the paper went out to everyone listed as a collaborator, so they had the chance to approve it and know that they were on it. And I got so many really lovely responses from people saying that they were grateful to be included, and that they were excited for the paper to come out. And these are people that maybe I've never interacted with in the context of the network. And some of them were, students or staff members who were maybe not always at the forefront of who's recognized as doing the work. And it was really lovely to see these people be glad to be recognized for their work. Because at the end of the day, the network is all these people, including both of you and all of the patient working group. The network wouldn't exist without all of these people's hard work. I know that every single person named on that paper is trying to improve the lives of people with cancer, or people experiencing cancer all across Canada and beyond Canada, around the world. So I'm really glad that we could recognize those efforts, even if it was in a maybe relatively small way. And I hope that, you know, all of those people and you are proud of that work and are happy with how it's represented in the paper.
Thank you for sharing that and for sharing this opportunity with all of us. It really does mean a lot. This seems like a great place to wrap up our conversation. Thank you for sharing your expertise with us, and congratulations on your paper. We hope to see the vision of the network that you laid out in the paper continue to grow and bring precision oncology to more cancer patients across Canada going forward.
Thank you both so much. This was such a lovely conversation.
Thank you.
Thank you.